All right, let's take a look at Chapter 2, which is the neoplasm chapter. Those of you that have had coding class before, I know this is always one of your favorites. So we're now looking at codes C00 to D49 for neoplasms. So with this, we are going to be using the neoplasm table. So let me flip over to Blackboard. And I went through this on the little video that I had posted, but here we want to be looking at this full neoplasm table, this PDF right here. So this really, coding out of this chapter, coding neoplasms, is the only time that you need to use this table. So I already had mine open right here, so I'm at the table of neoplasms. And here you'll see that we have 7 columns. So, and I'm including this as a column. So we basically have, notice that neoplasm is our main term, and then we have our subterms underneath that. So that's our first column, just to help us navigate essentially. So once we get to the neoplasm table, then we're looking for the site or location of the neoplasm. Then we have our 6 columns. We have malignant primary site, we have a malignant secondary site, we have carcinoma in situ, we have benign, uncertain behavior, meaning that they don't know exactly, the pathologist doesn't know. And then unspecified behavior would be that we don't have any further documentation. So this is the column we probably don't want to use if we can avoid it. So in terms of navigating the table, not too difficult. You're just looking for your location or site on the left and then choosing the appropriate column. Morphology codes, from my understanding, will still be used in ICD-10. The PDF documents that we are using to navigate ICD-10 do not include morphology codes, so for purposes of this class we won't be using them, but I did want to make a quick mention of these. I don't believe that they are changing with ICD-10, so I think that they'll still look the same as they do with 9. So it's 5 digits, you have an M, you have your you have 4 zeros, a slash, and then the last digit, not zeros, excuse me, but digits. So your first 4 digits are your histology, and then that slash, and this indicates the behavior. So that would indicate like primary malignancy, secondary malignancy, in situ, those kinds of things. So just be aware morphology codes will still be around. For purposes of this class, don't worry about coding those. Okay, so in terms of sequencing, really, I don't think there's really anything new in ICD-10 that we didn't already practice in ICD-9. So it's basically, again, going back to that principal diagnosis definition of why are they there. So if the treatment's directed at the primary site, we're going to list that first. If treatment's directed at the secondary site, we're going to list that first. If it's directed equally, then we'll go ahead and list primary first and then secondary. So we have our example here, carcinoma of sigmoid colon with small metastatic nodules in the liver, sigmoid resection of the colon carried out. So here, remember that metastasis or spread to or extension to, those are the kinds of words we're looking for to indicate that there is some sort of secondary site. So here we have carcinoma of sigmoid colon, that's going to be our primary site, and then we have metastasis to the liver. And they're coming in for a resection of the colon, which is going to be directed at the primary site. So the way we would code this is our carcinoma sigmoid colon, then we'd have our metastasis to the liver, and then we'd have our sigmoid resection. So let me go ahead and just kind of walk through this really quickly so you can get used to navigating the table. So let's do carcinoma of the sigmoid colon first. So if we go to our index here, I'm going to try my find function and see if carcinoma takes too long to get to. Lots of adenocarcinoma. Here we go. So if we look up carcinoma in the index, we are going to find it. So those of you not familiar with the neoplasm table might wonder, why do we have the neoplasm table? Well, here we can find a lot of different kinds of carcinoma. Notice that my subterms are not sites. So my statement reads carcinoma of sigmoid colon. Well, I can go down and I can look for colon. Not going to find it. I can scroll all the way down and look for, let's get to the S's, sigmoid. I'm not going to find it either. So really the subterms underneath carcinoma are indicating the histology type. The exact type, is it basal cell carcinoma? Is it acidophil carcinoma? Those kinds of things. our basic statement here just says carcinoma. So really what this does, it does tell us that it's malignant. So just by the terminology of carcinoma, it is considered malignant. So this tells us to go to neoplasm, which is the neoplasm table, and then the site, and then choose one of the malignant columns. So let's go here on my tab to the neoplasm table, and then we're looking for the sigmoid colon. So I'm going to type in colon here, and I'm going to go all the way back. So my first one isn't even in the actual table. This colon, it does give me, I'm pointing at the screen and then realize that you guys can't see that. It gives me colon here, but I don't have any sort of subterm sigmoid, so I'm going to keep looking, see if I can find something better. So we get down here, notice that I'm actually indented underneath intestine, large intestine, colon, and then here I can get all the way down to the sigmoid. And then I'm going to go over to the right and I'm going to choose the appropriate column. Now based on my alphabetic index, it told me it was malignant, right? So we know it's one of the first two columns. And then based on my statement, I know that it started here at the colon and it spread to the liver. So this is going to be my primary site. So I get the C18.7. And we'll just take a quick look in the C18.7 in the tabular malignant neoplasm of sigmoid colon, and which includes sigmoid flexure. All right, so we have that code. Now let's code our metastasis to the liver. Now it's still going to be carcinoma, so again I can go to my index and look under carcinoma. You can look down and look for liver. Keep looking. There's liver cell, but that is different than just metastasis to the liver. So don't be confused. That's a specific type of carcinoma rather than just carcinoma of the liver. So this isn't actually going to work for us. So we're going to have to go over to, here we do have liver NEC. Let's just double check on our neoplasm table and see if we get the same C22.7. I'm going to guess we'll get more specific because we actually know that it's a secondary site. So let's go over here to our neoplasm table. I'm going to go back up to the top. I'm going to type in liver. So here I get liver. And I do have primary malignancy, and then here I have secondary malignancy. So it's carcinoma, and we know that there was metastatic nodules in the liver. So it's actually going to be a secondary site. So here I get C78.7. Okay, so we do end up with a different code than had we just gone carcinoma to liver. And the main difference there is because it's a secondary site. So let's look at C78.7 in our tabular. Secondary malignant neoplasm of liver and intrahepatic bile duct. So we're pretty happy with that one. And those of you familiar with 9, you'll notice in the index, we normally would get a morphology code right here after carcinoma. They haven't included those, so I'm not going to worry about them for class. And then here we have sigmoid resection of the colon carried out. So that would be coded with the procedure coding system with PCS. So we got the code for the sigmoid colon first. Sorry, and then we got the metastasis to the liver, and we're going to code that second. Now, had they come in for, let's say, chemotherapy for the liver, we'd put the liver first, and then put the sigmoid colon second after that. I think that I've briefly mentioned pregnant patients. There's always something a little different there. So pregnancy codes always are sequenced first over any other codes. So we would end up with our O94.1, and again this dash indicates that there's some additional digits or characters needed. Malignant neoplasm complicating pregnancy, and then we'd add our neoplasm code after that. And again, you could have several of these if there were any sort of metastasis, or even 2 primary sites, I guess. Alright, if they're coming in for complications of malignant neoplasm, so there's several guidelines on this. We'll just it's just kind of giving you some information on the sequencing. So if admission is for management of a complication, some sort of adverse effect, dehydration, something like that, that's really going to be, they're coming in for the complication, so that's going to be listed first. Your malignancy is going to be your secondary diagnosis. The exception here is anemia, which any sort of anemia that's associated with malignancy, we're going to code for the malignancy first, and then we'd add the D63.0 anemia in neoplastic disease. Okay, we also still have our personal history codes. We used to get something out of the V10 category. For those of you that know ICD-9, we're now in the Z85 category, personal history of primary and secondary malignant neoplasm. So we need a few conditions to be true in order to code this. So personal history essentially means that the cancer is cured, if you were to use that term. So that means the primary malignancy has been excised or eradicated, there's no further treatment being directed at that site, and there's no evidence of any remaining malignancy. So even if a patient, let's say a patient has a mastectomy, but they're still undergoing chemo, that's not considered a history of breast cancer. They're still undergoing treatment. So if only one of these, even if the primary malignancy has been eradicated, if they're still doing any sort of adjunct treatment, then we cannot code it as a history of. It's not used to indicate history of a secondary site, just primary. And then again, even if the site's surgically absent, but they're still undergoing therapy, then we're still going to use that Z85. All right, we're not going to use that Z85 code, excuse me. And again, you can find that code in the index history, personal history of neoplasm, malignant neoplasm. All right, I quickly mentioned this, I think, in the sequencing presentation. If a patient is coming in for chemotherapy, immunotherapy, or radiation therapy, if that's the reason they're coming in, that's actually going to be listed first, and you end up with a Z code. So it's a Z51, and then whichever radiation, chemo, or immunotherapy. So this is principal or first listed diagnosis, and then your secondary diagnoses or additional diagnoses will be the type of neoplasm. So here's an example. Carcinoma of sigmoid colon admitted for chemotherapy. So in this case, I'm going to get the Z51.11, admission for chemotherapy. Then I'm going to code the carcinoma of sigmoid colon, which again I'd get off my neoplasm table. And then of course I would have some sort of PCS code for the actual chemotherapy administration. If they end up with some sort of complications during that stay, it's still basically the same order. They came in for the chemo or radiation therapy or whatever. This is the reason they're there for the chemo, radiation therapy, the neoplasm, and then these are the complications that occurred while they were there. If a patient has neoplasm-related pain, it's category G89, and then we have 0.3 subcategory that indicates neoplasm-related. So any sort of pain that's documented as being related, associated with, or due to a primary or secondary malignancy. And it can be acute or chronic in nature. If they're coming in for pain control or pain management, then it's going to be your principal or first listed diagnosis. If they're coming in for something to do with the neoplasm, that's going to be listed first, and then you would just have this as an additional code. Couple of more additional guidelines. C80.0 is disseminated malignant neoplasm unspecified. Basically, a patient has advanced metastatic disease, but there's not really a known beginning or ending point. So it's just kind of system-wide. And then C80.1, malignant neoplasm unspecified. This would be if we don't know the primary site of the malignancy. So sometimes they'll find metastasis maybe to the liver, but they're not sure where it came from. Then you can use this C80.1. There is a separate code if there's a secondary site that's unknown. Remission versus personal history. With your malignancies like leukemia and myeloma, those more kind of system type cancers, they do have codes for personal history of and for remission. So really with this is just watching your documentation to make sure that they really say, I mean, personal history, again, essentially means it's cured. So there is absolutely no treatment. It's not in remission. There's no really threat that it's coming back. I guess immediate threat, I should say. Malignancies associated with a transplanted organ. So these, again, it's just kind of a really specific guideline for a really specific scenario. If this happens, then you end up with a T86 code, complications of a transplanted organ, and then you get your C80, which is a malignant neoplasm with the transplanted organ, and then you would have a code to specify the exact type of malignancy that the patient is having.